Hi guys, it's Cricket, and it's day 4, March 4th, in National Endometriosis Awareness Month. And my fellow endo sister and I, Stephanie, put together a list of topics to discuss something about endometriosis every day for the month of March. Today's topic is symptoms. Well, symptoms of endometriosis vary so greatly. It all depends on where our disease adheres. Many people falsely think that endometriosis is a reproductive disease and it only affects reproductive organs. That is not true. Endometriosis can be found on ligaments. It can be found on bowels, bladder, ureter, lungs, diaphragm, even in very rare cases, the brain. So, depending on where the deep infiltrating endometriosis adheres, you could have symptoms that mimic something like Crohn's disease or IBS. It can attach to a sciatic nerve and cause pain there. It all varies and it's very individual. I used to be a terribly private person. If you knew me back in high school or college, you would probably be surprised that I'm the one speaking out on this topic. I know after my first surgery, I struggled with a way to explain my surgery to congregants at church when I returned. It was an embarrassing topic to discuss with other people. No one knew what endometriosis was. I was just figuring out what it was, and it was terribly difficult for me to discuss. The fact is that it's a gynecological disease, and our society places stigma associated with menstruation, gynecological disease, even our organs. Because of my progressed disease, I looked like I was carrying a full-term pregnancy. When I finally found a surgeon to listen to me, he feared that I had ovarian cancer because of all of my symptoms and the swelling in my abdomen. Dr. Richard Thomas in Utah saved my life. I had complained to doctors for years about my pain. Their suggestions, while I know were well-meaning, did nothing to help me with my disease, and in many cases furthered the growth of my disease. They told me that painful periods were normal, take some birth control, take ibuprofen and Tylenol, just keep taking it. I remember calling my gynecologist and saying, I think I'm worse on this birth control than I was before. And her office, the advice they gave me was, keep taking it. It was after that I had that episode at work that I mentioned in a previous video that caused me to really seek out help, to demand that someone take this seriously. When I had my first appointment with Dr. Richard Thomas, he discussed that he would do a 45-minute outpatient procedure to try to find out what was the root cause of all of my symptoms. That 45-minute exploratory type surgery turned into a nearly 6-hour procedure and a 4-day hospital stay. The outpatient procedure turned out to be the beginning of receiving answers. And although it was difficult, I remember it was the week of July the 4th because I watched the fireworks from my bed in the hospital. And I remember feeling grateful, just profoundly grateful, that someone listened, that someone cared, and that I knew what my diagnosis was. I knew I had endometriosis. That was one of the first questions I asked when I woke up from surgery. I remember asking the nurse, the doctor, whoever was there, anyone. I think I asked it several times. I was still under anesthesia, but I remember asking, was there something wrong with me? Was there something wrong with me? And that is the cry that many of us endo warriors have. Doctors say it's in our head. Friends and family sometimes allude that it probably is in our head. The pain and symptoms are probably something we're making up. But to be told in the hospital that you had stage 4 endometriosis, for me, was empowering, and it was the beginning of my journey. So to discuss symptoms would take me much longer than this short video clip, but I just want you to know and remember this. If you are missing work, hobbies, activities because of menstruation, that is not normal. That is not acceptable. And doctors who are okay with that really need to take a closer look at our condition. It only furthers the stigma, it keeps us from getting the help we need when we feel like if we mention it, we're looked at as weak. So if you are missing activities in your life because of pain, please seek out a doctor. Please seek out an endometriosis specialist. Not every gynecologist removes endometriosis or is skilled to do so. And we appreciate so much all of our doctors who look after our disease and health concerns, but you're going to need a specialist, especially if you have a progressed disease. Please seek help. Please know that although it is frightening to have your diagnoses, it is also empowering because you can begin to fight it. Thank you so much for watching and sharing our videos and our information. It really is our hope to spare other young women from the devastation of this profoundly painful disease. Thank you. I'm Cricket, and I'm an Endo warrior.